And it's time for The Doctor Is In, our weekly segment where you can ask a physician some questions, and we'll also have some pretty good stuff here. This morning we've got Dr. Ira Zunin, who is the medical director of Matakai Omalama Integrative Clinic. How are you doing this morning,
Great.
Doc?
Good morning, Ben.
Good to see you. Chronic pain is the subject for today, and let's just start from the very top. How do doctors define chronic pain? I mean, what is chronic pain?
Well, chronic pain technically is pain that lasts longer than 3 months. It's different than, oh, I just had surgery or just broke a bone. This is pain that lasts longer, but it's also pain where it's taking longer than we'd expect for it to recover. A lot of times we see changes in physician, changes in medicine, multiple medicines, and then it begins to affect the whole person, the ability to work, the family, and so on.
Yeah, so as far as treating chronic pain, a lot of these people who have chronic pain fall through the cracks for some reason or another, right? It's
a big problem. You know, the National Institute of Health estimates that as many as 50 million people suffer from chronic pain, which is more than heart disease, cancer, diabetes all put together, and costing about $100 billion a year. And a big part of the problem is that chronic pain patients, need so many different kinds of services, from physical therapy to surgery to psychology to medication management, and these services aren't always getting well coordinated. The docs aren't always talking to each other. Yeah, so when we talk about back pain or chronic pain, what are the most likely subjects that fall into that category? You know, like sure. Well,
back,
the big
neck,
ones.
what are we talking about?
Back is probably number one. Neck is probably number two. But there's a lot of folks with abdominal pain, pelvic pain, headaches, and then there's those that have had major traumas. Motor vehicle or motorcycle is a big one. Lots of broken bones. Yeah, because there are other ways for like pain management. You know, I mean, now there seems to be a little bit more talk about managing the pain or treating the pain a little bit more. At least that's what I've heard, right? Sure. I mean, what we're doing is we're looking at in our facility bringing together the best of modern medicine and traditional healing arts. So we're combining physical therapy, psychology, medications together with acupuncture, for example, for pain management, and also some mind-body techniques to help kind of get a grip and get control, get some mastery over the pain. Yeah, so is this the best way to treat chronic pain or to deal with chronic pain? Well, we're finding that it really helps, especially if we can coordinate that care and have the practitioners talking to each other. We're seeing improved quality of life, a reduced utilization of resources, less medicine, and we're also seeing people getting back to work and staying back. Yeah, because I'm sure when you talk about the psychological aspects, especially of chronic pain, it's like you go through the day or are used to going through the day just feeling okay. You know, I mean, you take for granted that you're going to step out the door and everything's fine. But if you've got your neck hurting or your back hurting or whatever all the time, it's got to take a toll on your brain. It wears you down, and even the strongest person ends up feeling depressed sooner or later. You've got financial problems, and now you're at home, self-esteem problems, and it begins to affect the entire life. Yeah. Well, good stuff, Dr. Zunin. Again, thanks very much, and hopefully we can deal with the chronic pain a little bit better. Good to see you, Ben. All right, Dr. Ira Zunin of the Matakai Omalama Integrative Clinic. And if you have a question for the doctor for our weekly segment, The Doctor Is In, please email us at morningmail@kitv.com, or you can visit our website, kitv.com, this morning.